What's going on, everyone? Happy Wednesday to everyone. Hopefully everyone is doing well, having a great day so far. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Wednesday edition of the Pandemic Update for Wednesday, February 7th, 2024. If you're new to my channel, you just clicked on to the daily pandemic update. Yes, we talk about COVID, but we also talk about other viruses as well that could be a threat to your health. So if you want to learn more, give this a thumbs up if you like what you see, and then subscribe down below, and you will see a video just about almost every day. And of course, share this with anyone you think may be interested in seeing this. Alright, starting off here. Canada geese are reportedly dropping dead in Massachusetts. Birds testing positive for avian influenza. Yes, avian influenza, bird flu. It continues to spread, and as you see here, it is now a problem up in Canada. Alright, moving on to this. Sickness spreading in Northeast Ohio school. This would be the Northside Christian Academy in Wadsworth was closed on Tuesday, so there is sickness. It's spreading. As you know, COVID is probably likely one of the causes for this, and other viruses as well, but oftentimes they do not mention the word COVID. Moving on, we have yet another school to talk about, the Hayden Canyon Charter School. This is up in Idaho, has closed yesterday, Tuesday, due to an illness outbreak. Moving on, we have yet more to talk about. This time it's Harvard. Harvard University Health Services warns students about spike in respiratory illness. And no, this is not something that is from last year. This is something that is going on right now. As yet again, there is another surge ongoing with these viruses, COVID, flu, RSV. Some of them are starting to rise again. Harvard University Health Services leadership warned affiliates to exercise additional caution amid rising cases of respiratory illness in an email to Harvard affiliates on Tuesday. So apparently, you saw wastewater recently, and we're going to show it again today. The Northeast has been rising. Well, it's starting to impact what's going on at Harvard, and they are reporting high levels of respiratory illness, including flu, COVID-19, and RSV. We had thought RSV peaked in much of the country, but apparently at Harvard, they're still seeing high levels of all three viruses. Now we come to this. Remember the Indianapolis Colts owner was dealing with an illness, Jim Irsay? Well, apparently he has finally made a statement on X, formerly known as Twitter, and he is saying that he is grateful for all the messages of love and support, and that he is now on the mend. So that is some good news to hear that he is starting to do better. All right, we've been talking about measles lately. We haven't talked about it in the past week, but I found this, and I thought this is rather interesting. This map shows where measles are spreading. It's spreading in several different states, and you can see here it's spreading in Washington State. It's spreading in California, Georgia, Missouri, Ohio, Pennsylvania, New Jersey, Delaware, and in Maryland are all dealing with measles cases over the last several months. So it's obviously something that we're concerned about, and it's something that we will continue to follow. All right, yesterday the update for Michigan came in. I actually found an article reporting on it this week. It says last updated on Tuesday, February 6th. At 4:34 p.m., this post will be continuously updated with Michigan coronavirus locations and updated COVID-19 news. Great to see that there's still some media reporting on the virus. Confirmed COVID-19 last week climbed. Their cases in Michigan actually climbed to an average of 489 per day, up from an average of 445 the week before. Michigan public health officials reported on Tuesday. The state's 164 hospitals reported 569 confirmed COVID-19 patients. Now, there's some good news with this. That was reported on Monday. That's down from a high or so far this year of 1,275. Data released on Tuesday also added, wow, another 227 deaths to Michigan's tally, bringing the pandemic total to 39,996. Most of the deaths were in mid-December, and the jump is likely due to the holiday backfill. I don't care what it's due to. That's a lot of deaths in 1 week, and they just had a really high report on the previous week. So, yeah, the deaths are, yeah, they're still far too high. And something else I should point out that they do point out, which is I'm glad they do. Experts say that the state confirmed cases are likely a vast undercount because many people either no longer test for the virus when they have symptoms or rely on at-home tests. Well, hello, if it's an undercount and you know so, make people have to report their at-home test. It's not that hard to do. It's really easy, and it helps us data reporters like me or the people that collect the data get a more accurate account of what's going on. Sheesh. Alright, moving on to this. We have to take a look at today's air quality data. Let's refresh this. It will come up eventually, and what you're going to see is our usual mixed picture across the country. Most areas are fine. Some areas are having some air quality concerns. You can see across the Great Lakes, there are some slight rises in air quality today. And even along the Appalachian Mountains, you can see here there's a few areas with air quality issues. And we are seeing a few areas with air quality issues in California today. Not certain if that's because of fireplace season or maybe the storm that is finally starting to wind down there. Hard to say. If you want to learn more about the weather and what goes on with weather and climate, I do have another channel where I do just that. I did post today's climate update. You can see here I did it just 15 minutes ago. That's why we're a little bit late today. There was a lot to go over, and there are a lot of data for me to look at. If you want to subscribe to that channel, you can do so down below. All right, let's take a look at Walgreens for this week and what we will find in Walgreens this week for the positivity indexes that, as you know, some states did rise. As seen in all these states which are red, and there's quite a few of them, but the national positivity rate still did drop. It's at 26.6%, down 0.7%. Testing was down ever so slightly, and if you look really closely here, right between Virginia and Maryland, really hard to see. I'm going to try and click on it. Here we go. Washington, D.C. Look at this. Wow. I'm just actually noticing this. 25% positivity rate in D.C. Prior week was 18.2%. That's a difference of up 6.8%. Total test is 16, and that is down from 22. And you can see here, again, there are several states that did rise this week. Some did drop as well. Iowa dropped from 15% to 12%. 50 tests versus 60. That's with testing being down, so that's a good thing. What did Florida do this week? Florida had, wow, still a lot of testing in Florida. I'm actually impressed. 26.4% positivity rate versus 28.8%. That's down 2.4%. And total testing here, look at this. 3,300 tests versus 3,800. Again, that's a big decrease, but for Florida, I mean, Florida does have population, but, you know, Florida's the virus is a hoax. The Surgeon General of Florida says, "Oh, don't take the vaccine," blah, blah, blah. So I'm impressed that many people actually had the courage to do the right thing and go out and get tested. All right, let's take a look at some wastewater data now, shall we? Well, first off, let's take a look at what's going on with the latest hospital capacity in the U.S. And we can see here 77.9% of all beds are being used. It's pretty much holding steady at this point. And 3.2% of that is because of COVID or for COVID. Influenza, 1.4% of those beds being used, and ICUs. Let's take a look here. The national ICU level is at 73% of ICU beds being used, 3% for COVID, 1.6% for influenza. Taking a look now at the latest data from Biobot, if we can. Yep, here it is. You can see here that national wastewater level, it is starting to rise at, again, I think it's just going to be a short-term rise, but hey, who knows? We'll have to see what happens again next week. Here it is. And you can see here, yep, it started rising again. Shouldn't be a surprise. If you've been following my channel, we've been dissecting some wastewater sites on Wastewater Scan that have been starting to rise again. The Northeast is seeing the biggest rise. The Midwest, it's not dropping anymore. Neither is the South, and neither is the West Coast. Hopefully those regions do not start rising again. Just have to wait and see what happens when we get new data on Friday. All right, going over to Wastewater Scan. I have written down here 3 areas that I want to look at. First off, we need to take a look and see what's going on in New Jersey. And let's get as close to New York City as we can. In fact, I think we're going to do 2 wastewater sites here. Let's take a look at Newark. Because if Newark, New Jersey, which is a big wastewater site, is starting to rise, Houston, we got a problem. Let's see here. So, good news. Newark at this time, though it tried to rise again, it's going back down. We'll have to see here if that last update holds true. Hopefully they really are starting to drop. The overall trend has been down. And taking a look now at what's going on with RSV, you can see RSV was dropping, then leveled. Now it's trying to rise again. And again, this is a big sampling. 1.5 million population. Influenza, all these are still in the high level, by the way. Influenza A is dropping. Influenza B, on the other hand, it's rising at this time. That's not good to see. And it still is high. HMPV is high. Norovirus is high. And yikes, norovirus, it's maybe trying to drop, but it actually had a bit of a run there of a rise late in January. Hepatitis A, it's still being detected. And I'm not seeing any Mpox data listed here. Let's go down one more site in New Jersey. There's another site just to the south of us. Let's go down to the Somerset one, shall we? This would be Bridgewater, New Jersey. 130,000 population. Uh-oh. Look at this. COVID's still high. There's that reversal that we're starting to see in other wastewater sites. It's happening at this wastewater site. RSV is flat at this time. It's still high. Influenza A, I don't know why this is still listed high. It's come down pretty low. Look at that. I mean, you're almost coming down to near zero. It's not at zero yet, but it's almost down there. Influenza B is low, but it is rising slightly. HMPV is not much of an issue. Norovirus continues to drop overall. Recent updates suggest maybe it's going to start going up again. It still is in high levels. Hepatitis A, there were some detections. Let's see, when were these detections? Recent detections. So hepatitis A is showing up in wastewater. Now let's go out west a little further. We want to take a stop in Arkansas. And you may remember here, this was a wastewater site. Let's see, is this it? Yes. City of Harrison, Arkansas. And let's see what is going on here. You may recall, we talked about this site just a few weeks ago for their norovirus situation. Well, first off, COVID. Overall trajectory here, it's flat. It looks like maybe it's trying to drop, but look at this. It was trying to rise a little bit again. Still at high. RSV has really come down. That's not even going to be listed high pretty soon, should that continue. Influenza A is dropping. Influenza B is dropping. They're still high, but they're dropping now. And take a look at this. Okay, so we see there was a change and there was a correction in norovirus. We can see in January, instead of going straight up, it was more of an up-down regimen. It is not going straight upward anymore, and now it has really come down. Still in high levels, but it has really dropped from this massive rise that they were seeing to end out the year of 2023. That is some good news. Hepatitis A, unfortunately, you do have some detections of that. And Mpox, not seeing any detections of that at this time. All right, let's do one more stop. This time we're going to go out to California. And let's just randomly go in California. How about we go up to see what's going on in Sacramento? I don't believe we have looked at Sacramento in a while. COVID is coming up as medium. High RSV. You can see here the charts. They keep the graphing. They keep the lines really low on these charts on some of the sites in the West Coast for some reason. Not certain why that is the case, but taking a look here at influenza A, you see it's coming up as high, but again, same thing with influenza B. It's coming up as high, but the levels on these charts do not suggest that it is as high as they are saying. HMPV is high, but it is starting to rise once again. Norovirus is medium at this time, and there have been some detections of Mpox as well as hepatitis A. Look at these Mpox detections back in late January. That is not good to see. All right, let's move on now and take a look at the latest data from the CDC. And the JN.1 variant, what I can tell you is the latest variant that is well ahead of everything else. It is well over 90% at this point. I don't know why the CDC website is going around in circles. And let's see here. Okay, we can take a look at the influenza data. And the influenza data at this time, you can see here, there are still some areas that are in the very high category. New York City, South Carolina, Georgia, and New Mexico at this time are all having very high levels. And then there are several states that are dealing with high levels, including Washington, D.C., Texas, Louisiana, Arkansas, Tennessee, Ohio, Wyoming, and even up here in North Dakota and Colorado. By the way, D.C. is not a state. They're just listed separately because, it is a smaller area within this map here, and it is good to see what's going on. They do the same thing with New York City, because New York City is so populated within such a small area like DC is, so they do that separately, and I think it's really good that they do that. If you're traveling down to Puerto Rico, minimal influenza at this time. All right, taking a look at the latest data from the Philadelphia Fire Department. Yes, we look at Philadelphia because we can't give you any other daily EMS totals from any other city in the country, but we can do Philadelphia. It's better than nothing, right? 701 EMS incidents. That's pretty good. That's nowhere near that concerning 800 level that we talk about sometime, and it's been staying low for several days. Let's take a look at what's going on in the burbs of Philadelphia, because we can't. There's public CAD system here. I wish more states and cities would start having public CAD systems in their counties. Montgomery County, not terribly busy right now. We do see a couple nauseous and vomiting incident calls. That's not good. And of course, stroke. It's never good to see stroke. Total of 13 incidents right now. Chester County, wow, not busy at all in Chester County. Mind you, it is 6:14 at night, but just 3 calls. That is fantastic news. We haven't seen levels this low in quite some time. New Jersey, hospitalizations continue to fall. 898 hospitalizations. That's with 69 out of 70 hospitals reporting. 30 people are on a ventilator. In the ICU, 97 patients at this time. Discharges, 169 discharges in the last 24 hours, so that's a good number. Taking a look now at what is going on in New York State. Hopefully New York State will come up. Here we go. 1,700 new cases reported in New York State in the last 24 hours. And of course, we have to take a look at New York State hospitalizations, which I do draw a red flag today. And you're probably going, huh, why is that? Well, take a look here. Hospitalizations, they did drop. They only dropped by 2 today. And the number of people in the ICU dropped slightly. 1,898 people in the hospital, 202 people in the ICU. I was running through just to figure out, why did that not drop all that much? Well, let's come down to Long Island, New York. This may be part of the reason. And of course, it's going to refresh on us. But let's come down here to zoom it back in. Let's take a look at what's going on in Long Island, New York. And you have to zoom in a little further. I'm sure you can see it, even zoomed out that far. Here you go. Yesterday, Long Island had 368 people in the hospital, 45 people in the ICU. On today's report, it went up. 387 people hospitalized and 47 people in the ICU. So that could be part of the reason why the overall drop in New York State slowed down a little bit. Not good to see. I don't think it's going to lead to anything major. Maybe it's just a bump in the road. But hey, we'll have to keep an eye on it. You never know. All right, let's see if we got an update out of Colorado today. I've been refreshing this all afternoon. Haven't been seeing anything. Let me refresh it again. Let's see. If nothing, that's all I have for today. But hopefully we can get an update out of Colorado. And look at that. It looks like we did. And they have in the hospital 154 people in the hospital. That is down by 9. And it does show here. Look at this. Ooh, this is not good. Cases reported this week, 2,554. Why is that not good? Because that is up by 379. And the positivity rate is 8.9%. That's up by 0.3%. Emergency department visits are now up by 0.1% as well. This could signal, if should this continue, they may start to see hospitalizations either level off or start going back up again. Not good to see Colorado joining the party of rising cases. I believe this is the second week in a row where they now had cases rising in Colorado. Alrighty, folks, that does it for today's pandemic update. If I didn't share something about your state or where you live, I apologize. I try my best to find data in different places that we haven't talked about in a while. I tried for Arizona today. Couldn't find anything for Arizona. I tried for a couple other places. Couldn't find anything. I report on what I can find. I will see you guys all again next time. However, if you're new to the channel, hit that thumbs up button. Subscribe down below. Let's see if we can get to 100 likes today. The more likes we get, the better these videos will do in the algorithm, and the more we help keep people informed and help them stay safe. So share this. Subscribe. I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Wednesday evening. I'll see you all tomorrow. Bye-bye. Thanks for watching.